Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker. Very excited you are joining us, especially because February is a special month. February is Heart Month, and heart disease remains the #1 cause of death in America, meaning that in this pandemic, heart disease is still real threat. So we're very excited to have with us cardiological interventionist with CIS, Dr. Prejean. Welcome to the program.
I'm glad to be here. Thank you for having me.
All right, we appreciate it. Look, one of the things that while we're in February and it's Heart Month, why should people be concerned about their heart health?
So heart disease remains the leading cause of death in America. So if you look at all cancers combined, heart disease still leads that in terms of cause of death in America. Wow. And we know, especially here in South Louisiana, we love good food and having a good time, but we also know all too well that heart disease is very common in South Louisiana. So in addition to worrying about all the other things we've been worrying about with the pandemic and things, it's important to focus on the normal health concerns, and including your heart health.
Yeah, so heart disease doesn't go away because we're in a pandemic.
Exactly.
Right? Yeah,
exactly.
So we've still got to be worried about it. And so I think very often people wonder what is it that maybe puts them at risk, and maybe why they should go and see a specialist like yourself.
Yeah, so there's certain things that you can control, and then certain things that you can't control. So things like your genetics, so a family history of heart disease and first-degree relatives, especially like your mom, dad, brothers, sisters, and your age. So as we get older, heart disease becomes more common. And then other things, so things like diabetes, high cholesterol, high blood pressure, smoking, being overweight or not being very active. Those are the things that might be modifiable. And the good thing is if we catch those things early, then our goal is to prevent the heart disease before it even happens.
Yeah, I've heard one of the cardiologists tell me that if people kind of wonder what the difference is, when it comes to smoking, the day you quit smoking, the first cigarette you stop smoking actually starts to improve your health. Right?
That is true. So heart disease, specifically atherosclerosis or blockages in the arteries, is an inflammatory disease. So the heart arteries themselves develop plaque, and that process involves inflammation. Smoking causes inflammation in those arteries. It raises your blood pressure. It disrupts your cholesterol. So the day you stop smoking, those effects start to go away. And really, after a year, after 5 years, your risk goes down significantly.
Yeah, and so if people are in that age range at 55 or that 65 and they've got some of these issues that they're dealing with, they should call and make an appointment with you guys over at CIS.
Yeah, there's nothing better than when I get somebody who says, hey, I'm really concerned about this. My dad had a heart attack at 50 or even earlier, and I just need to come to you to kind of just see what should I be doing. Mm-hmm. And it's way better to meet that person on the front end than on the back end, maybe 10 years later when they're having a heart attack in the hospital. I like, go and help people in that setting, obviously when they need it, but I like it even more when I see them in clinic before and we talk about things we can do to actually prevent problems before they happen.
And quite frankly, some of those people don't know, and so as we wrap up this segment, I will tell you that I am so very glad that CIS actually saved the life of one of my family members, because he went in knowing that his dad had similar issues at the same age. He went in and a week later, he actually needed to go in, had a stent, then they realized he needed bypass. So that was one of those examples just like you gave. So if people are hearing this, they really need to pay attention to that.
Right, exactly. So even if you're not having any symptoms, we focus on the things that we can prevent, like the blood pressure, cholesterol, quitting smoking. But if you are having symptoms, especially, we want to see you and see you soon.
Very good. And Dr. Prejean, we were talking about some of these symptoms or things that people need to look for, but sometimes there's some gender-specific symptoms that people need to be aware of.
Yeah, so the classic symptoms of a heart attack or pains related to the heart, which we call angina, are a chest pain, which may be a pressure or a heaviness on your chest. Some people describe it as an elephant sitting on your chest.
Right.
These pains can go to your left arm, your shoulder, your jaw. Okay. So those are really concerning about heart pains. Those may be associated with shortness of breath or nausea. One thing that we like to harp on, especially in women, is that, and especially in patients who may have diabetes or other conditions, they may have atypical symptoms. So these include nausea as a predominant symptom, some abdominal discomfort, So any symptoms kind of in the chest, anything that doesn't feel right, especially those symptoms when you exert yourself or get anxious, those may be symptoms in the heart. And we specifically ask females to tell us even if they're having more atypical symptoms so that we're not missing things that might present in a different way.
Right, and it's really important to be able to kind of break those down and let people know anything that's making you feel out of sorts or things that you've just described. It's important to consult with your cardiologist.
I agree.
Okay, very good. Now, what are some of the ways that people can actually prevent heart disease? We talked about knowing if it's there. How do we prevent it?
So it starts with our lifestyle.
Okay.
So eating a diet, that is heart healthy. So this includes things that are low in cholesterol, avoiding red meats, things like fish and white meats are better for you. And we talked about not smoking, being active. The American Heart Association recommends that you do about 30 minutes of walking or other moderate exercise up to 5 times per week. So that starts with your lifestyle. And then if you have certain conditions, whether that be high blood pressure, high cholesterol, diabetes, just keeping those under control. So you may have that, you may be diagnosed with that and not necessarily be thinking about your heart, but eventually down the road, if you have that for many years, that can affect your heart or other areas of the cardiovascular system.
Yeah, and blood flow. It'll affect lots of blood flow
Right.
issues, and we see that exacerbate in other areas.
Yep. So that's one thing we didn't discuss. So cardiovascular disease can present in many forms. So we deal with strokes. That's the heart attack of the nervous system or your brain. And then we also see a lot of peripheral arterial disease in the legs and other areas. So those symptoms, may present with pain in your legs as you walk. With the leg symptoms, strokes, obviously we get concerned if you have any difficulty speaking, slurred speech, facial droop, or any neurologic symptoms. So those are things to look out for.
Okay. And one of the other things we talked about a little bit, especially on this, the time of year that it is, it's interesting that February is that month, and we're starting with Mardi Gras, but limiting yourself to 1 drink a day also makes a difference.
Right. So alcohol has kind of a dose-dependent range. So in low doses, it's fine and may actually be beneficial in some settings for your heart. But heavy alcohol use can weaken the heart, lead to things like congestive heart failure. We also see a higher incidence of a common irregular heartbeat called atrial fibrillation or AFib with alcohol. So we call it holiday heart. If you go kind of on a Mardi Gras type drinking binge, then you can see that develop.
That holiday heart. Doc, we can't thank you enough for all the information that you provided to us, and I think it lets people know kind of what to do and maybe when to do it. We also want people to know that Heart Month is a perfect time to go get your heart checked. To learn more about this or to go and see a CIS physician like Dr. Prejean, you can go to www.cardio.com, or you can give them a call here at your local CIS, Cardiovascular Institute of the South. I promise you, like they did my family, they'll take care of you. Doc, I can't thank you enough for coming on.
Thank you for having me.
All righty, that'll do it for us. Don't go anywhere. We have a special with Martin Falls as he sits down with Dr. Peter Fayol, another cardiovascular interventionist, as he talks about some special things happening with the heart. Don't go anywhere. We'll be right back.